Well, during the pandemic, we met because of open source medical supplies, which I'm really glad because you got it like to my life. So during the pandemic, I kind of used my skills as a volunteer and someone with a disability to really help me navigate, help other people's lives. With an education level, my parents are not college educated, and that's really kind of influenced me to understand how language barriers affect people. Low education has kind of been my life. College wise, no, I don't have a finished college degree because unfortunately, with my disability, oftentimes I'm in the ICU a lot or the hospital a lot, and that has caused barriers. And then pre-COVID, I was like, yeah, this is going to be the time I'm going to finally, I'm very stable now with my medication and my health. And then COVID happened. I was like, well, this is very weird. What are we going to do? So I started shifting, and that was really great. Now I'm at a point where I was like, yeah, I'm going to find a solution here. So it has been a strange time, but one thing I found in skill set has been utilizing resources, being able to navigate them and other people as well. I'm disabled. My disease is genetic. I rely on a lot of specialists, but despite my disability, I've always been able to adapt, which is kind of necessary when you have a disability. Partnering with a lot of nonprofits during COVID and pre-COVID has really been useful. Believe it or not, the pandemic has actually made things a lot more accessible for me. And sometimes it was hard to get people to always listen or see me. It's like I've mentioned, at one time I went for a position, a volunteer position, and they said, oh, you're not actually a good fit based off of the physical characteristics. And now occasionally people will say, oh, yeah, you're a good fit. And they're like, oh, I didn't know you were disabled. And it's interesting in that aspect because you wonder, well, am I a good fit based off what you're seeing on Zoom or because of the physical aspect? So it's interesting the dynamics and the presentation of the pandemic in that way. Moving forward, I'm really excited, because I think education is going to be more accessible to people with disabilities because you have the Zoom format. Because it means online education is going to be more accessible and physical education is going to be more accessible. So people who go in the ICU a lot won't have that, problem of falling back. That's how I came from a background of homeschooling, APs and things, because I was able to manage that well, as traditional schooling was more complicated for me.